Welcome, everyone, to a journey into the intricate world of autoimmune diseases, specifically focusing on a rare and challenging condition known as autoimmune retinopathy, or AR. In this video, we'll unravel the complexities of AR, exploring its causes, how it affects the eyes, the diagnostic process, treatment options, and the ongoing research aimed at improving the lives of those affected. Autoimmune retinopathy, as the name suggests, stems from a malfunction within the body's own immune system. Instead of protecting the body from external threats, the immune system mistakenly identifies components of the retina, the light, sensitive tissue at the back of the eye, as foreign invaders. This misidentification triggers an autoimmune response, where the immune system produces antibodies and immune cells that attack and damage the retinal cells. While the exact trigger that initiates this autoimmune response is often unknown, genetic predisposition, viral infections, and even certain cancers have been implicated as potential contributing factors. Now let's delve into the pathophysiology, or how autoimmune retinopathy actually damages the retina. The rogue antibodies produced by the immune system target specific retinal cells, most commonly photoreceptors, which are responsible for capturing light and converting it into electrical signals that the brain interprets as vision. The attack on these cells leads to inflammation and progressive cell death. As photoreceptors are destroyed, the retina's ability to process light deteriorates, resulting in various visual disturbances. The specific symptoms and the speed of vision loss depend on which retinal cells are targeted and the severity of the autoimmune attack. Autoimmune retinopathy is considered a rare condition. Estimating its exact prevalence is difficult due to diagnostic challenges and the potential for misdiagnosis. It's believed to affect a relatively small proportion of the population compared to more common retinal diseases like macular degeneration or diabetic retinopathy. AR can affect individuals of any age, but it's more frequently diagnosed in middle-aged to older adults. Both men and women are equally susceptible. The signs and symptoms of autoimmune retinopathy can be quite varied and often mimic other retinal disorders, making early diagnosis challenging. Common symptoms include progressive vision loss, which can range from mild blurring to severe impairment. Many individuals experience photopsias, which are flashes of light or shimmering sensations, even in the absence of external light sources. Another common symptom is visual field defects, meaning blind spots or areas of reduced vision in specific parts of the visual field. Some individuals also report increased sensitivity to glare or difficulty with night vision. The specific symptoms and their severity can fluctuate, making the condition even more perplexing. Diagnosing autoimmune retinopathy requires a thorough ophthalmological examination and a comprehensive evaluation to rule out other possible causes of retinal dysfunction. The exam typically includes assessing visual acuity, visual fields, and examining the retina with specialized instruments like an ophthalmoscope. Electroretinography, or ERG, is a crucial diagnostic test. It measures the electrical activity of the retina in response to light stimulation and can reveal characteristic patterns of dysfunction suggestive of AR. Furthermore, blood tests are often performed to detect the presence of antiretinal antibodies. However, it's important to note that the presence of these antibodies isn't always conclusive, and their absence doesn't necessarily rule out AR. Clinical judgment and correlation with other findings are essential. While there aren't strictly defined classifications or subtypes of autoimmune retinopathy, it's often categorized based on the specific retinal antigens targeted by the autoimmune response. Some forms of AR primarily target photoreceptors, while others may affect other retinal cells, such as ganglion cells. Identifying the specific antigens involved can sometimes provide clues about the potential severity and progression of the disease, but it doesn't always dictate treatment strategies. The primary goal of treatment for autoimmune retinopathy is to suppress the autoimmune response and slow down or halt the progression of retinal damage. Immunosuppressive medications are the cornerstone of treatment. These medications, which may include corticosteroids, methotrexate, azathioprine, or other agents, work by dampening the activity of the immune system. Intravenous immunoglobulin, or IVUG, is another treatment option that involves infusing the patient with antibodies from healthy donors, which can help modulate the immune system. In some cases, localized therapies, such as intravitreal injections of corticosteroids, may be used to target inflammation directly within the eye. The specific treatment regimen is tailored to each individual based on the severity of their condition and their response to therapy. Careful monitoring is crucial to assess the effectiveness of treatment and manage potential side effects. Unfortunately, there's no proven method to completely prevent autoimmune retinopathy, as the exact causes remain elusive. However, maintaining a healthy lifestyle, managing underlying autoimmune conditions, and promptly addressing any potential triggers, such as viral infections, may help reduce the risk. Regular comprehensive eye exams are also essential for early detection and prompt management of the condition. The prognosis for individuals with autoimmune retinopathy varies considerably depending on the severity of the disease, the specific retinal cells affected, and the effectiveness of treatment. Some individuals may experience relatively slow progression of vision loss with appropriate treatment, while others may face more rapid and severe visual impairment. Ongoing research is focused on identifying novel therapeutic targets and developing more effective immunosuppressive strategies. There's also growing interest in exploring regenerative therapies, such as stem cell transplantation, to potentially restore damaged retinal cells and improve visual function. While these approaches are still in early stages of development, they hold promise for the future of autoimmune retinopathy treatment. Thank you for joining us on this insightful exploration of autoimmune retinopathy. We hope this video has provided you with a deeper understanding of this complex and challenging condition.